Hi, my name is Chad Campbell, one of the fellowship-trained spine surgeons here at Campbell Clinic. We just want to talk a little bit today about endoscopic spine surgery. Endoscopic spine surgery is a minimally invasive technique that we can use to address spinal pathology in people that have a specific area of pain. It usually goes down their legs or down their arms and can also involve numbness and weakness as well. The endoscope itself is a tool. It is essentially a camera with a hole in the end of it, as well as a light source that allows us to directly visualize the pathology through a very small, less than 1 centimeter incision, and actually address the pathology without causing any damage to the tissue or muscle around the pathology itself. Usually it's a disc herniation or a disc bulge causing things like sciatica or pain in somebody's neck or arms that's pressing on a nerve. With the endoscope, through a very small incision and dilating through muscle and not actually removing it or cutting muscle and not having to drill away bone, we're able to get directly to that disc herniation and remove it without causing damage to any of the muscle or bone in the adjacent area. The general procedure for an endoscopic spine surgery, it is a surgery that's done either under general anesthesia or moderate sedation, and the patient goes to sleep and lays on their stomach. While they are asleep or sedated, I make a small incision over their back. I dilate through the muscle and then insert the endoscope, and through that small dilation and cannula, I'm able to get right to the disc herniation, remove it, and when the patient wakes up after the surgery, their leg or arm pain should be resolved. Because there's not any cutting of muscle or drilling of bone, the patient's back pain when they wake up is generally fairly minimal. In traditional microdiscectomies or treatment of sciatica, it does involve an incision and removal of bone and dissection of muscle, which after surgery does entail some level of back pain and recovery period. Because we don't have to cause the damage to the muscle or bone, patient's back pain is generally much reduced compared to a traditional microdiscectomy. While a traditional microdiscectomy or a tubular discectomy, the more traditional ways of doing the surgery are very good surgeries and do address the patient's leg pain. The benefit of this is that with the less destructive approach, we don't have to worry about as much back pain following the surgery itself. With the minimally invasive approach, especially with endoscopic surgery, the benefits generally are that it does have a lot less blood loss. There's less damage to the muscles and bone in the area we're working. The infection risk is significantly reduced. And afterwards, the recovery period is significantly decreased as well. Patients generally have very little pain and don't even need pain medicine following the surgery. Because of the reduced damage to the muscle and bone in the area, we are able to generally let people get back to activity fairly quick. It is somewhat quicker than the traditional surgeries just because of the decreased amount of damage that we're doing to the muscle and bone in the area. People are more comfortable getting back to sports or activities quicker, and it's also slightly safer for them to do so without causing any further damage. Because we don't have to fuse the bones together, the recovery period is significantly reduced, where we don't have to wait for bones to heal. People can get back to their normal activities within a couple days or weeks, whereas for a fusion surgery, we have to wait about 3 months or more before people can get back to their usual activities to allow the bones to heal. Endoscopic spine surgery is very good at addressing specific pathology, meaning a disc herniation that's pushing on a specific nerve and causing pain, weakness, or numbness in a certain area of the body, whether it's the arms or the legs generally. It's not very good for treatment of back pain or neck pain. And it certainly can address any kind of spinal instability or fractures, but for removing pressure on nerves, it is very, very good. Because we are able to do it under general anesthesia or sometimes even without any general anesthesia with just sedation, we are able to perform surgeries on people sometimes that would otherwise be unable to undergo a spinal surgery. There's less risk because of the decreased anesthesia that's needed, so it does allow people to get relief that sometimes are unable to do so otherwise.